Whitlaner retractor, Babcock forceps, scissors, artery forceps, tissue forceps, scalpel, probe, surgical blade. The anterior portion of the cockerel is placed face to face. The cockerel should be controlled by tying with any kind of rope or rubber tubing. Care should be taken to keep the pressure of the knot optimal. Two wings are upwardly attached and tightened with optimum pressure. Defeathering is done around the surgical region both sides of the cockerel. The location of the expected surgical incision is being detected. Usually, the chicken possesses 7 pairs of true ribs. The incision site is being marked. Now, the most important part is to detect the exact location of the incision. The incision is done just between the last 2 ribs. Existence of the uncinate process must be remembered during performing the incision. Avoid too much friction to the uncinate process by the surgical blade. The same procedure is practiced in the opposite side of the cockerel. Properly sterilized surgical drapes with 1 square inch center has been used in this surgery. Surgical instruments should be boiled for about 20 to 30 minutes to sterilize properly. Now, the cockerel is ready for surgery. Placement of surgical blade is being done on the surgical scalpel with maintaining proper sterilization. Chlorhexidine solution is used to sterilize the area. Location of the incision site should be properly ensured. Bleeding from incised area is being controlled by rubbing the area with surgical gauze soaked with warm normal saline solutions. About 2 cm incision is given. Care should be taken to avoid injury of the visceral organs. Placement of Whittliner retractor is being performed by the aid of an artery forceps. The testis is located between the junction of lung and the cranial aspect of kidney. Insertion of the Babcock forceps into the abdominal cavity to hold the testis. Displacement of the intestine to reveal the testicle. After locking the testicle, the Babcock forceps is rotated for several times until the testicle is free from its place. The testicle is removed by sharp surgical blade. Usually, no need to suture the incision. The same procedure is repeated on the other side of the cockerel. We should be careful to avoid unnecessary friction on the ribs and uncinate process. rubbing the area with gauze soaked with warm normal saline solution. About 2 cm incision has been given. Insertion of wet liner retractor to open the area. Locking the testes by Babcock forceps and removing it by same procedure. Usually, the left testicle is typically larger than the right in most young chickens.